Hello and welcome to the European Lupus Society podcast. I'm Chris Wincup, a rheumatologist working in the lupus clinic at King's College Hospital in South London. I'm delighted to be joining you today. I really think that we've got some interesting things to discuss here as this podcast focuses on an area of lupus that's often very, very challenging for both clinicians and patients alike, and that is with regards to the subject of fatigue. Now, this is something that you probably will hear frequently in the clinics if you're a clinician, and is something that you may relate to similarly if you're a patient listening to this. So in the next 10 minutes or so, I think it's worth going through some of the latest information with regards to fatigue. In particular, we can look at why fatigue is important in lupus, how we can decide to measure this, what factors may contribute to fatigue in lupus, and then moving on to thinking about how this can be treated and what does the future hold for this troublesome symptom. Now, it's often very difficult. I've done work in fatigue previously, and I find that one of the most challenging things to do is actually define the word itself. Different people will mention different things when thinking about fatigue, and it can come in a number of different forms. For example, it can be a physical or mental exhaustion. Some patients may describe it as a sensation in their muscles, that of weakness, or in some cases breathlessness, whilst other patients may report it as cognitively exhausted, suffering from difficulty thinking and the inability of thinking straight or composing thoughts. Now, in trying to prepare for this podcast, I went online. I had a look at the Oxford English Dictionary definition of fatigue, and there you'll find it's defined as a feeling of being extremely tired, usually because of hard work or exercise. And I find that's really not helpful at all with what we're seeing in clinic. Now, in my practice, one of the most common questions that's asked is, why am I feeling so tired whenever I'm seeing patients with lupus? And I must admit that I sometimes skirt around the answer slightly and will typically list a number of facts in the hope that that will shed a bit of light, if not give any specific information about how we can improve it. So I usually start off by saying, well, 80 to 90% of patients report fatigue to be the single most debilitating symptom of their lupus. And I've got to say, when I first heard that, I thought that was absolutely fascinating. From the position of being a doctor, I often thought that patients would be predominantly worried about the development of kidney disease, those kind of things that as clinicians we're often focused on in the clinic. But no, it really is fatigue that is listed in many previous studies as one of the most common and debilitating symptoms of lupus. So when I try and answer this question of why patients with lupus are suffering from fatigue, and again trying to skirt around the answer slightly, I often say that there's no correlation really with disease activity. Sure, if you've got very active lupus, you're going to feel fatigued, but fatigue does remain a problem even for patients who are in remission. Similarly, there's no obvious improvement with standard treatment. It's simply a case of increasing steroids or further immunosuppressants. Fatigue is a symptom reliably, and it's not something we usually do in practice. And what I usually say is this is a challenge for patients in that it's severely debilitating, but it's also a problem for clinicians. And I think one of the reasons why some clinicians may not like to talk about fatigue is often, as doctors, we like to treat things, we like to make things, and with fatigue we often struggle to give any meaningful suggestion as to how fatigue can be made better, and sometimes people may try avoid asking this question in clinic, and therefore it may be somewhat underrepresented, but essentially in answer to this question as to why am I so tired, I frequently have to turn to my patients and say, well, I'm not entirely sure why you're so fatigued and whether it's due to the lupus or not. So why is fatigue in lupus important? Well, as I've mentioned already, it's common. 80 to 90% of patients with lupus report it as the single most debilitating symptom. Now, if we were seeing 80 to 90% of patients developing kidney disease or arthritis, then I think that really would be ringing alarm bells. And so we should be thinking about fatigue in that very, very serious way that we would with major organ manifestations. It's also very, very debilitating. So it has an impact for work, education, social life, school, depending on the age of the patient. As I mentioned, it often goes unnoticed. We frequently find lupus is reported to be what we call an invisible illness, where the symptoms often go unnoticed, and that really is the case for fatigue. As I mentioned, it's very, very hard to explain and to define exactly what fatigue is, and it's an important symptom because it's incredibly frustrating. It's frustrating for patients, whereby frequently clinicians will be telling them that things are looking better, DNA antibody levels are improving, SLE diet, but the fatigue remains an issue. Another reason why fatigue is important, well, as I've mentioned, it's very difficult to treat, and until quite recently it's been often under-investigated and understudied. Similarly, there are no real good blood tests to tell you how fatigued someone is, and fatigue is often quite unpredictable. I've got to admit that there are some patients where I think that we've completely fixed the lupus, we've switched everything off, and fatigue remains a major issue, and with that it does get quite challenging. Similarly, fatigue is incredibly hard to measure in clinical practice for some reasons that I'll move on to talk about now. So in terms of fatigue, often we can think about questionnaires. The FACIT fatigue questionnaire is a fairly straightforward, short questionnaire looking at various different domains that has been validated in lupus and declaration of interest. I've used it in some of my research in the past and found it to be quite useful. Similarly, another short forms such as the short form 12 or short form 36 questionnaires are also quite useful for measuring fatigue. Again, a very general instrument that's not specific for lupus but has been validated in lupus. If we think about lupus more specifically, though, the lupus qual is a quality of life measure specifically designed for lupus and does have domains for fatigue, although is a more general measure. And similarly, we may wish to use a fatigue visual analog score, or VAS, which is simply marking on a line and coming up with a number of the amount of fatigue. Their benefits each has their own drawbacks. We may want to look at fatigue scores in terms of a physical score, and again this comes with complications. In many other conditions, a 6-minute walk test is considered to be a good measure of physical function and can be helpful with regards to physical fatigue. However, with patients who have arthritis or other joint pains, it can be challenging, and there are important confounders here. Grip strength has been used in the past as a good measure of fatigability in health, but again, due to the small joint pains that are very commonly reported in lupus, this is perhaps not the best measure. So when we think about what contributes to fatigue in lupus, I often think that there's a broad spread of different things, and thinking about the possible contributing factors towards someone's fatigues may inform some of the treatment. And the first thing to really consider is disease activity. As I mentioned, correlations between disease activity and fatigue levels. It goes without saying that high levels of inflammation, a highly active lupus disease, in particular with major organ involvement, will be associated with some fatigue. But frequently when we switch off that, when we see improvement in blood tests or proteinuria, fatigue does remain a problem. Now, there's a really interesting paper published a couple of years ago in 2020 by a French group headed up by Laurent Arnauld, in which clusters of different patients and fatigue with a number of other symptoms were looked at closely. I'd really recommend, it's really interesting, patterns of fatigue and association with disease activity and clinical manifestations in systemic lupus erythematosus. It's published in Rheumatology in 2020, and it was a really interesting study looking at just over 500 patients, looking at a number of components, including fatigue, and what was found was that there were 3 real clusters of patients. The first cluster were patients with relatively low disease activity, with significant levels of fatigue and low levels of anxiety and depression. So that was one cluster. In a second cluster, there were patients again with low disease activity, but very high levels of fatigue, but also associated high levels of anxiety and depression. And then in the third cluster, it was patients with that high disease activity and high fatigue, but with low levels of anxiety and no depression. possible things that may be contributing to someone's fatigue, most importantly, disease activity. So there are a number of other things that we need to consider when confronted with fatigue in patients with lupus. For example, is there an intercurrent metabolic disorder? Now this is sometimes perhaps the most easy to identify and treat. We know that hematological manifestations of lupus are quite common and can contribute to fatigue, most notably anemia. Not just talking here about autoimmune hemolytic anemia, but many patients will be suffering from anemia of chronic disease, and some of the research common in patients with lupus, and also state of functional iron deficiency, i.e. there's a bit of inflammation that's preventing normal iron metabolism, which could also be contributing to this. When we also think about other metabolic problems, thinking about low vitamin D levels, we're thinking about thyroid disorders as well, which can all be screened for. Sleep disturbance, well, that's another very important thing to think about when talking about fatigue. I try to take a relatively detailed sleep history from my patients who are suffering from quite high levels of fatigue. Problems with sleep are widely reported in a whole host of autoimmune rheumatic diseases, not just in lupus. There is an interesting previous paper by Palagini et al. That was published in Lupus in 2014. It was a study of 81 female patients with lupus, and it noted that nearly 2/3 of patients described very poor quality sleep or early morning wakening, and that their sleep quality was generally quite poor. Other studies have shown that pain is a real key predictor for poor quality sleep, and therefore it's important to also think about how pain may be impacting on someone's sleep and ultimately on fatigue as well. There have also been some studies looking at this in a bit more detail, saying that patients with lupus often find it more difficult to initiate sleep, to get off to sleep, and to sleep throughout the night when compared with healthy controls. That was a paper Johnson and Hetter in Clinical and Experimental Rheumatology in 2001. On the subject of sleep and pain, it's also important to consider fibromyalgia. It is a common comorbidity that coexists with lupus. We know that it exists at levels that are probably higher than the general population, but still not at those huge numbers that would attribute all of the fatigue and pain in our patients. So it's important to consider that and also treat that as appropriate. Other factors that impact on sleep, such as respiratory symptoms or restless leg syndrome, have also been reported in lupus. There was a study published in the Journal of Rheumatology from the team in Toronto in 2006, looking at sleep disorders, sleepiness and depression, that really gives some interesting information on this. Furthermore, I think it's important to consider mood. Now, I have some hesitance. We know that intercurrent depression and anxiety can impact on sleep, and similarly can impact on fatigue, and that strong correlations are often drawn between fatigue, depression, and anxiety. But it's often somewhat chicken and egg. It's hard to tell whether the patient is feeling the fatigue due to the mood disturbance, or quite understandably, if they're feeling fatigued and they're having significant impacts on their quality of life, then this may be contributing to depression and anxiety rather than the other way around. So it's very difficult to tease out those associations. Medication is another really important thing to consider. It's something that we often will be reaching to try and help improve with the sleep. For example, as we've mentioned, if the disease activity is high, getting on top of that, treating the active disease, we hope will help with actually make things worse. And similarly, as I mentioned, looking for things like fibromyalgia, poor quality sleep. Sometimes the treatment of that may also exacerbate fatigue. And now corticosteroids are well known to cause disturbances in sleep and can frequently exacerbate fatigue. Although similarly, there have been studies show that non-steroidal anti-inflammatory drugs have also been associated with increased levels of fatigue and poor sleep, independent of pain scores. In the management of pain, it's important to check the medication list. Opiate-based analgesia, certain essence, and anxiolytics can have sedating side effects that can all exacerbate fatigue. So a good review of the medication list is important. Something slightly more controversial, a little bit more difficult to study, is whether central nervous involvement directly from the lupus contributing to fatigue. There have been some very interesting studies looking at disruptions within the blood-brain barrier through functional MRI, suggesting a possible increased permeability in patients with lupus, and therefore, who knows, it could be a case that this increased permeability on functional MRI may allow pro-inflammatory cytokines within the central nervous system, which is usually a fairly immunoprivileged site, that could be making fatigue worse. Similarly, on this subject, many people have looked for biomarkers of fatigue and ultimately have come up a whole host of very non-specific interleukins and pro-inflammatory cytokines have been studied, although the results have been very variable and there's been nothing that's really given any secure suggestion of a useful biomarker in clinical practice. So we've considered all of the possible ways in which fatigue may occur. That is a very long list, and it's important to consider that in many patients there may be more than one of those, and there may be various overlapping areas, such as the treatment of one may exacerbate sleep and make fatigue worse. But in terms of a practical approach on how to treat fatigue, what I often feel is it's important to look at that medication list. If the disease is active, certainly I would have an onus on treating the disease activity in the first instance, see if that improves the fatigue. Anecdotally, there is a suggestion that hydroxychloroquine can be a good drug for fatigue. Hydroxychloroquine is actually a really good drug for all patients with lupus who are able to tolerate it. But if they're not on hydroxychloroquine, it may be worth a trial of that for a few months to see whether things improve. There were some interesting secondary outcome data in the BLISS studies suggesting improvement in some quality of life domains with belimumab, albeit I've not seen any significant improvements in fatigue anecdotally that I've seen treated with that, even when it has helped to bring disease activity under control. On the subject of medication, it's important to again review the other medicines the patient's on. In terms of pain control, keep it simple, try and avoid the opiates which may be contributing any vitamin deficiencies. I'm thinking about iron deficiency, vitamin D deficiency, screening for thyroid disorders and treating as such. And in terms of the next steps, your kind of non-pharmacological treatments of fatigue, well, there was a study published by the Guy's and St Thomas's group a number of years ago, in which patients were randomized to either no intervention, relaxation therapy, or paced supervised exercise. And it was the paced supervised exercise group who did report improvement in their fatigue scores in the longer term, although the caveat for that is when they stopped with the paced exercise, the fatigue levels were. And also it can be very difficult to have a conversation when a patient is feeling extreme fatigue to tell them to go and do exercise when it may not feel physically possible. Again, it's important to remember that doing a little bit frequently is a lot better than pushing too hard, which will likely exacerbate things, and starting with very gentle exercises. I often advocate doing stretching exercises, Pilates, things like that, just for a few minutes each day, and gradually building up will hopefully help, but it's certainly not an overnight fix. And again, on non-pharmacological treatments of fatigue, encouraging good sleep hygiene is really important. It may help with the sleep and may improve the fatigue, but will be unlikely to take that problem completely away. And similarly, other groups have looked at mindfulness and meditation. Now, these are interesting techniques. Patients do sometimes report that it does help with their fatigue, but frequently it's helping them to manage their life with it and to have that difference in mind. In terms of what the future holds, well, who knows? We're currently exploring a number of possible hematological causes that may be contributing to this, and hopefully we'll have more data to share in the future. But in conclusion, fatigue is a common and debilitating problem for patients with lupus. In some cases, the causes are very obvious and easy to fix. However, in many cases, they are not. in many cases there's no obvious underlying cause. It's important to switch off active lupus and then review the medication list to make sure that that's contributing to the fatigue. Exercise does help, but is difficult. But hopefully with a better understanding of the symptom, a better understanding of the mechanisms, we may come to better treatments that are better informed in the future. So thank you very much for listening to this podcast. It's been a pleasure. It's been a pleasure to be invited by the Society to speak on this subject, and certainly I would suggest reading those papers that I've mentioned in this podcast. And I look forward to catching up